Before we start to talk about ethics, let us first reflect on the humanistic view of mankind. Mankind are human beings, each with one's own ability to be self-determining. Having the ability to be self-determining leads to other human qualities such as freedom of choice, creativity, the ability to be aware and responsible. However, these self-determining qualities can have effects on society, causing problems in our daily lives and how we treat each other. Thoughts and feelings like what is the meaning of life, or what it is to be a human being, or how I can live a good life become challenging life questions, creating moral dilemmas that can sometimes be very confusing. The word ethics originates from the word ethos, which describes dealing with what is good and bad, what is a moral duty and obligation. One can say that ethics is like a pattern of how we live our lives by acting and making decisions in different situations. One can also describe ethics as an exploration of actions and norms that lead towards a good life. How we view what is good and bad, what is a moral duty and obligation, all depends on our own moral. What is a moral? Well, the definition of moral is how we relate to principles of right and wrong through rules and individual values. In fact, moral and ethics are often used in the same context because they both originate from the Latin word mos or moris, which has the same meaning as ethos. For example, how we conform to a standard of right behaviour depends on our own individual values based on our own understanding of what is right and wrong. Our own individual values have their roots grounded in our family upbringing or experiences we have had in school or at work. But if everyone was to act accordingly to their own individual values of what is right and wrong, we would end up living in a society that is totally chaotic, with everyone enjoying complete freedom and doing exactly what they want to do, without rules and guidelines of proper behaviour. Rules help to promote a safe society, thereby giving us a sense of living life without a constant worry of being in danger. A British philosopher, Thomas Hobbes, stated that if mankind was left to ourselves, we would be at constant war. Therefore, we require strong leadership and social guidelines to help us conduct in society acceptably. Even Plato and Aristotle contemplated on this, both believing that it was the responsibility of the state to provide moral education to its citizens towards a healthy community. Therefore, mankind needs social guidelines to help us conduct acceptably, and these are what we call norms or codes of conduct. A norm is a principle of right action, sort of like a policy to help us control or regulate acceptable behaviour within a group. Norms, however, can be very complex because they are developed by a magnitude of different customs, culture and behaviour within a diversity of different social groups. There are different types of norms to help us act properly in different situations. The most common normative rules that we abide by daily are norms within social adequacy, law, profession and religion. For example, normative rules within social adequacy are rules that help guide us in a social setting. For example, not to lick your knife at the dinner table, or what topics are acceptable to talk about during a formal dinner. Normative rules within law are rules connected to different values within suffering and death. For example, rules within healthcare or laws around murder, rape or assault. Normative rules within profession are rules to guide us on how one should conduct one's job professionally. And normative rules within religion. These are rules which follow the ethical and moral beliefs of different religions. Throughout our lives, we'll face many situations where we have to make a moral decision. Making moral decisions is a big part of our daily decision making, and quite often we don't even reflect on it. Every day we make decisions on what is right or wrong, and what would be the best course of action to take in a particular situation. We often make our decisions by judging other people's actions and characters. Every so often we use expressions like gut feeling or intuition or the voice of conscience to help us make moral decisions. We also have ways of justifying our actions and making excuses for when things go wrong. By listening to what we call the voice of conscience or intuition or our gut feeling can also be a refusal to look at why we act in a certain way. Two concepts that guide our moral decisions are our conscience and intuition. The word conscience is defined as a sense of the moral goodness of one's own conduct, intentions, or a feeling of obligation to do right or wrong. Our conscience is a collection of our moral perceptions and our practical experiences that all add up to create a feeling of what we consider to be the right course of action in a confusing situation. Intuition means to look at intently, or in other words, to look inwards. Intuition has also been understood as part of our imagination, for the reason that our imagination enables us to come to a sense of clarity in confusing situations. Intuition is also a sense of feeling things are right. These feelings don't necessarily mean our personal feelings, but instead a sense of a direction about where one is going. And intuition can also be a conviction based on past experiences that helps one decide on the correct course of action. Conscience, feelings, and intuition all possess some kind of self-insight, but they don't really possess a reason for why we act and make decisions like we do. To help us become morally aware or ethically competent requires training, especially within the context of caring. As a nurse, your goal is to care and look after people who are sick and suffering. One can say that the normative rules of caring is to ease suffering through increasing well-being, respecting self-determination and integrity, having respect for human dignity, and treating all people fairly. Caring for others can give rise to circumstances where ethical values and norms put us in challenging situations that require making a moral decision. As a future nurse, you'll be working in an ever-changing and dynamic working environment. You will meet daily people from all walks of life, cultures, and with different physical and social needs. You will have to interact and collaborate with other health professionals and follow national and local guidelines and rules ensuring patient safety and procedures. Daily decisions promoting health can sometimes generate conflict when other colleagues, patients, cultures, customs have another view on life values or what is right is wrong. By saying that, it is therefore very apparent that ethics and caring are impossible to separate.